welcome back. You're listening to MoneyLine. I'm your host, Eric Lay, here every Saturday from 11 to noon, talking about money. And today I have Dr. Enrico DiVito, founder of the Arizona Center for Laser Dentistry, joining the program. Dr. DiVito, how are you?
Great. Thank you, Eric.
I really appreciate you coming into the show. You are now my dentist, so I'm excited. And you're a pioneer in basically the best and new technology, laser dentistry. Tell the listeners a little bit about, laser dentistry.
Sure. First of all, I've been a dentist for almost 31 years now, and during that time, I've been able to experience all of the different modalities and treatments that are available for patients, and many of those are the typical drill and modalities that we use every day. But about 7 years ago, I became very interested in laser dentistry. That's using lasers or light energy to accomplish the same things that we do with the drill, but in a much more minimally invasive way, to be specific. And so I went on this quest to learn how to use lasers, and to be honest with you, I think I brought it to a whole new level, and it's working out very well.
Well, you're truly a pioneer. You've developed parts of the laser, correct?
I've used special technology to take what was already available in the laser industry and bring it to a whole new level, such as performing things like root canals, actually using the laser to decontaminate and sterilize cavities,
right,
et cetera. Yeah, it's been really nice.
Now, the big talking point on the laser is no shot, no drills, virtually pain-free dentistry, correct?
That's correct, yes. It's amazing as it sounds. One of the reasons I became so enamored with this idea was that it appeared to me that by using the laser, we were able to do it without any anesthesia, which is huge in our field because most patients, as you know,
right,
are afraid of the shot.
Right.
And then to be able to perform these procedures in less time, in many cases, and with more efficiency, just made it a win-win for me.
One of the things when we were talking about the laser and what brought me to you was, like I was talking about when I was a kid, I broke my front teeth slipping on a rock. Then, of course, so the pain, I think I was 8 years old, the pain associated with it, going to the dentist, this was probably 30 years ago. Then I also hit in the mouth with a baseball a couple times, so I had to get root canals. I didn't have a cavity until I believe I was 25, 26 years old, but I had more drills, and then we had braces. And going to the dentist, I would go to the doctor, put a shot in my arm, no big deal. I was never afraid of the doctor, but going to the dentist truly scared me. And I have sensitive teeth, or I believe I have sensitive teeth. And when I would get shots, they would say it's supposed to numb me up, but it never did. I can always feel it. And so they would give me more and more shots, and it got to the point that I couldn't feel the shot. But when that drill went in, it did hurt. And I'm looking forward to going in and trying the laser. I haven't tried it yet, and I'm not really nervous. I think it's something that I don't want to say I'm looking forward to it. I'm looking forward to making my radio smile into a TV smile, but I'm not I'm not really afraid. I'm looking sort of forward to the laser technology.
Eric, I will tell you that what you've just described to me is what the majority of my patients talk about. I mean, those very experiences that you had, many of my patients have.
Right.
That's why I was very focused on coming up with this technology and technique. The other part that's really fascinating for me is that now with the children that we have that are coming in the office, this is going to be a whole new group of patients that will not have experienced pain.
Absolutely.
Will look actually forward to going to the dentist, and you know what the value of that is.
Well, having a 6 and an 8-year-old, I was mentioning, it's already dramatic. My 6-year-old, he had some fillings, and I think he was 5 when he had the fillings. And the poor child, I mean, as a parent, it just, it's gut wrenching. And, the pain, I'm assuming there's pain, but it's just scary. And the sound of a drill, I mean, that's one of those sounds that every listener out there can relate to, going, you hear that drill sound and you're instantly thinking pain. You can almost taste and smell the drill when it's going in. And that was one of the things also, you're more precise with the laser, whereas a drill, there's maybe cracking and you're doing your best with the drill as all dentists do, but the laser, you don't have to, you can save more of the tooth?
That's correct. You've done a great job at explaining it. Mostly what we find with using a drill, the conventional drill, it's as you can imagine, a small object that's turning very, very rapidly. And as you touch it to the tooth and begin to try to remove the decay and some of the areas that you need to get to, that drill in itself creates a lot of heat. And with it, the vibration causes a lot of cracks in the teeth, and that's something that all dentists face in their career.
Right.
So it doesn't matter really how technically efficient or precise you are as a dentist. The sheer nature of the delivery system, the drill, makes it difficult. That's why some of my patients, when we do these conservative fillings that I thought was pretty straightforward, they come back and say to me, look, Doc, it looks really good, but it's sore. It's sensitive. Right. I can't take the cold.
It's a drill.
It's a drill, exactly. Well, with the laser, it brings a whole new level of technology to the table. Imagine being able to remove tooth structure in microns, very, very, very small segments, instead of having to approach the tooth with a drill that sets up cracks and craze lines. Imagine being able to focus on just the area that you need to work on, having it selectively remove just the part that's decayed and not remove the healthy tooth structure around it. This is the level we have now with lasers. And with that comes the ability to do it with less time, less invasive, less pain, and more conservative overall.
Right, and when we were talking about it earlier, it fuses the tooth, whereas a drill will leave cracks, which is going to most likely lead to maybe more cavities in the future, whereas the laser, almost the heat of the laser fuses the tooth, so it actually makes it a little bit stronger?
Well, one of the things it does is it actually, as it's removing tooth decay, it vaporizes the bacteria that are involved. When you have tooth decay, there are bacteria. By sheer definition. So one of the things we try to do as dentists is eliminate all of that bacteria and then go ahead and fill it with a material that's more, shall we say, aesthetically pleasing for that tooth, okay? Well, with the laser, we're able to remove it, disinfect it, and at many times desensitize that area. The lasers that we're using now are pulse lasers. They're not continuous lasers. It's a lot of complicated mechanisms, but I will tell you a little bit more about that as we get into it.
Well, folks, I'm talking with Dr. Enrico DiVito. He's a pioneer in laser dentistry. This is the new thing in dentistry. Basically, shot-free, pain-free. That doesn't go, I mean, you never hear that with dentistry. I've talked about it. I've always been, I don't like going to the dentist. I've had problems from the past. I've had the drill in my mouth, and that's something that I think anybody out there that's had a drill, it's nothing that you look forward to. This is laser technology. So, folks, when we come back, I'll be talking more with Dr. DiVito about laser technology. You're listening to MoneyLine. I'm your host, Eric Lay, Extra Sports 910, the Valley Sports Leader. You're listening to MoneyLine. I'm your host, Eric Lay, here every Saturday from 11 to noon. Always talk about money, and today we're talking about laser dentistry with Dr. Enrico DiVito, founder of the Arizona Center for Laser Dentistry. Dr. DiVito, we were talking a little bit about your office, and the technology that your office has allows people to go in and get things done in one visit, where in a lot of offices, they might have to come back 2 or 3 times.
Yes, that's correct, Eric. One of the things I'm particularly proud of is our ability to take patients who need, for example, simple fillings or crowns or caps and transform them within an hour and a half to 2 hours with that particular unit. Typically, in dentistry, if you break a tooth or you need a crown placed, it takes a couple of different appointments. One appointment to prepare it, then a temporary has to be put on, then the patient goes home. Then they come back again in 2 weeks. You have to renumb them up again, typically. Take the temporary off, place the crown on, hope it fits. If it doesn't, and many times it doesn't, you have to retake another impression, place the temporary on and on. With laser dentistry and our new CAD-CAM, which is a term that's used for computer-generated milling, we are able to take 3D images of these teeth and create the crowns right there within 10, 12 minutes, and then have our machine use porcelain to actually mill out that tooth, place it in the patient's mouth, all within 1 hour. So the patient comes in with the problem, leaves with the solution. No second appointment. In a time-starved and technology-crazed world, we find that our patients are just loving it.
Okay, and seriously, that's amazing. And so give me the example of the patient that's out there right now, has some dental work that they need done that could take them 2 or 3, 4 visits at another dental office that you can get done in an hour. Because I'm listening to this, and I think I'm the candidate going, hey, this is what I want. I want to be able to go in and not have to wait 2 weeks with the temporary and then come back in. So what's an example? Give me an example of that client that's out there that you're going, nope, I'm the one that you want to come to.
Well, pretty simple. Most of our clients that come in typically are coming in because of their hesitancy to go see a dentist because they're either in pain or they've broken a tooth, or both. Right. So we get a call and we have them come into the office, and after I've analyzed the situation, a patient has a broken tooth. Depending on how far it breaks, if we can just place a crown on that tooth, we'll do that, or some sort of a conservative crown. If it's really bad and they need a root canal, then typically we'd have to focus first on the root canal, then have them come back to prepare the crown, and then after that, they come back another time to take the temporary off and put the permanent crown on. Well, now, because of laser dentistry and the level that we've reached, we're able to perform the root canal using lasers, prepare the teeth using lasers, scan the teeth with computers, create and design those crowns, and then place them all, usually within an hour and a half to 2 hours. That's one appointment, 3 different techniques are being used.
Well, and I'm going to say, not to interrupt, but cost. I mean, you're a dentist, and as doctors, you have your time. That is what you're scheduling, and doctors have to schedule their time. That's how you make money. So the fact when a patient has to come back 3, maybe 4 times if something just doesn't fit or look correctly, that adds up to money. You can be the best doctor in the world, but that's going to add up to money. And being able to do it in 2 hours, I've got to just assume it saves people money.
Absolutely. And Eric, that's the whole issue here. In our office, we not only use this laser technology and all the technology we have, but we deliver the product in less time, more efficiently. And I'm asked this quite a bit, well, this must cost considerably more than routine dentistry. And the answer is no. In our office, it's the same as we were doing for conventional dentistry. The real value is the patient has less time and less visits. And that's got to be worth something to them, too.
It's worth something.
And that's why everyone talks about, our time and et cetera. But how many patients do I hear, what about my time? That's important.
Right.
Yeah? I always laugh with them. What about your needs, right? Yes.
Right.
Well, in a time-starved and technology-crazed world, this is the answer.
Now, if you're out there and you're going, I would like to talk to Dr. DiVito, I want to set an appointment, give their office a call at 480-699-4340. Again, that's 480-699-4340. Now, we're talking about, not major dentistry, but what about somebody just wants to get how about their teeth cleaned?
Yeah.
I'm assuming you do that too.
Oh, absolutely we do. We take care of all general dentists. I'm a general dentist with advanced training in laser technology, so there isn't a recognized specialty yet, but that's changing. So if you want to come in just for a regular cleaning or a checkup, we still do that. I have some very interesting technology that has 3-dimensional imaging so that we can not only look at the tooth from the outside, but we can actually rotate it around and look at it from the inside to see if there's any possible pathology or cavities on the horizon that are coming up.
Preventive.
I mean, the whole thing is preventive. So if we can get these things before they get to the point where they're very costly and very timely, that's a win for you too.
And plus, it's going to save your tooth.
Absolutely. It's all about conserving the patient's dentition.
And how about like teeth whitening? I know teeth whitening is a popular subject out there. Do you do a lot of teeth whitening?
Absolutely, we do. Yeah, teeth whitening is probably the most sought after treatment in our practice out of all of the modalities we offer. It is the least invasive. It is the easiest and quickest thing to do. And we use lasers to help potentiate the effects. So not only do we take regular whitening, but we also use lasers, which adds a whole new level of the ability to whiten the tooth.
Right. And when we were talking about lasers, earlier, how long? What's the difference between the way with a drill, like a root canal, let's say, using a drill compared to using a laser? What's estimated time difference?
Well, I'll just give you an estimate because it's different in most
Right.
dental offices. But typically, depending on the dentist or the specialist that does root canals, it takes anywhere from, I'll give you an hour to an hour and a half. Most dentists will try to complete root canals, let's say, in one visit, but in many times it takes 2 visits, depending on the infection. With laser dentistry and some of the more sophisticated treatments that I have brought to the table, and this is all part of my patents and IPs that I've put together, we're able to complete these root canals typically in 30 to 45 minutes, and we have the same results and, in many cases, much more efficiency.
Again, this is without a shot.
That's correct.
No drills.
In most cases,
it is
pain-free.
pain-free.
Yeah, and I will say in most cases, because there's occasionally the 2 or 3% or 5%.
I'm going to be that one, Dr.
I know, and we're looking forward to it.
I'm going to be that guy that I'm going to go in. I'm like, oh no, I'm the only one that has sensitive teeth. But I'm definitely, I'm so intrigued on the new technology, and what really got my interest was with children. I mean, if already my children have gone to the dentist. They've had the drill. My youngest has had the drill. So if I say we're going to the dentist, it's no matter if it's just a teeth cleaning or X-rays, the kid is going, hey, I don't want to go to the dentist.
They're fearful, yes.
So I think the first time, if you're a parent out there, that first experience, you're conditioning that child for the rest of their life to go into the dentist. Going to the dentist is so important. And quickly, we were talking about your mouth and your teeth and the health of your teeth. And actually, it affects a lot more than just your mouth. And from what I'm hearing, it actually can affect your heart.
That's correct. We as dentists have often recognized the relationship between oral health and cardiovascular health. And now the American Medical Association has made a statement that saying there is a direct comparison. That is, if you have disease or pathology in your mouth, it usually is correlated with heart pathology, and it makes sense. So to get your mouth in good shape does nothing but make it better overall for your health, and particularly put less strain on your heart.
Dr. DiVito, great information. I really appreciate you coming on the show. I look forward to you coming on the show again in the future. If anybody would like to talk to Dr. DiVito or set an appointment, give them a call at 480-699-4340. Again, 480-699-4340. Dr. DiVito, thanks so much for coming on the show. I really appreciate it.
Thank you, too, Eric.